How can staff be more deaf aware in healthcare services? Our 5 top tips. Top tip number 4, beat the queue and visual alerts. When deaf people need an appointment in the GP, it's really good to use the beat the queue, because the interpreter's time is quite precious and both of you need to be at the appointment on time. So a quick response and get a conversation is good. Because the doctors give 10-20 minute appointments and the interpreter's time is quite precious, so you need to be in and make sure they can both get in. 30 minutes is a long time. So it's good when you arrive at the doctor's if you can beat the queue and get in on time so that you use the interpreter and the patient's time effectively. Also, if you've got a visual display, the deaf person can be aware of when the appointment time is. They've got access to information that would otherwise miss. Deaf people, when they arrive at a GP surgery, you need to make sure that the doctors need to make sure that there's a visual alarm system. So on the walls of your surgery in the waiting room, you need to have a flashing alarm system that's accessible to deaf people while waiting in the waiting area. If the alarm is blocked by walls and the structure of the building, then you need more than one visual alarm, because a deaf person must have a line of sight to see the alarm is actually flashing. So you must make sure that there's a visual alarm and it's accessible to deaf people.